you can go to the doctor, 5, 10, 15 years in a row, and they could tell you your blood sugar looks great, blood sugar looks great. And it may not even show up on your A1C levels. But then all of a sudden you're told you've got prediabetes and you're kind of throwing your hands up in the air going like, well, what the hell happened? How did I end up with prediabetes?
Hey, what's up, guys? Welcome back to the Rejecting Average podcast. I'm Brett Betcher here with my brother Chris, and we're excited today to chat a little bit about something we're pretty passionate about. It's the idea of insulin resistance, and talking about the rejecting average side of this is insulin resistance is a topic that is very underrated as far as health outcomes, but definitely underreported and under examined out there within the mainstream medical approach. You see it a lot more online these days, which is great that it is becoming, at least in that realm, more mainstream. But we still see people go to the regular checkups and things, and they're still not really being tested for the most important markers of insulin resistance. So, with that, Chris, how you doing today? And let's get into some of these.
Yeah, I'm doing great, Brad. This is definitely kind of right up there on the top of my list in terms of health topics that I enjoy getting into. And because, like you said, it's ignored. It's not taught in school, and I think you and I would even agree with that. Going through our doctorate programs, like I don't think I ever heard the word insulin resistance come up one time. And I know that's exactly the same thing that's going on in medical school. I know that's what's happening with nurses and nurse practitioners. It's just not in mainstream medicine. And yeah, we want to get into it because I think it's tip of the spear when it comes to longevity and overall metabolic health.
Yeah, absolutely. So I guess with that, kind of talking about the idea of, ultimately, what is insulin resistance? How does that present? And how can people be looking for that?
Yeah, we can dive in here right away. So as far as insulin resistance goes, biggest thing is insulin is a hormone that's produced in the pancreas, and it's what basically you can think about it as a key that unlocks your cells to allow glucose to come from the bloodstream or blood sugar for lack of, or for as far as a more generic term. It allows blood sugar to enter the cells so that the cells can use it. Now, over time, what happens is your body is starts to develop a resistance to that insulin. And what I mean by that is your body, as it produces that insulin, it needs more and more and more of it to be able to get the same effect. So you basically need to produce more insulin to continue to unlock those key or for those keys to be able to unlock the cells to let the blood sugar come in. And that happens when you're exposed to high amounts of blood sugar week after week, year after year. This is something that develops very slowly over time. And again, you wouldn't necessarily even know that you're developing it unless this is checked. And so, fasting insulin is probably one of the most important biomarkers. I would argue that everyone should be asking their doctor to check or at least getting a third party to be able to test it so you can get an idea of where that's at. Because what ends up happening is you can go to the doctor 5, 10, 15 years in a row, and they could tell you your blood sugar looks great, blood sugar looks great. And it may not even show up on your A1C levels. But then all of a sudden you're told you've got prediabetes and you're kind of throwing your hands up in the air going like, well, what the hell happened? How did I end up with prediabetes? You told me last year my blood sugar looked great. But what ended up happening is your body was slowly needing more and more and more insulin to keep your blood sugar stable. And all of a sudden, it kind of ran out of opportunity to be able to produce enough insulin to keep up. And that's how you end up kind of in that pre-diabetic phase of things. So I'm going to pause there for a minute. Brett, you got any other holes you want to fill in? Just kind of some simple things.
Yeah, I think you kind of talked about what causes that or what kicks that off, and I think there's multiple ways we could go with it, but I think two of the more obvious ones that stand out are one, a loss of muscle mass, and we kind of talk later on maybe why that's so valuable. But if you could be again the same age, and then 1 year passes, and yeah, you see those numbers trickle up, and it's a lot of times because either A, you're losing some muscle mass along the way, or B, maybe you're adding on, a little bit of visceral fat in the process. And both of those things are, correlated with insulin resistance, and higher visceral fat, and that's the belly fat specifically, is related to insulin resistance because your visceral fat, that fat tissue itself, is actually active, it's living. So you're actually producing your own inflammatory, call them cytokines. It's basically like a something released by those cells that then act on the organs and tissues around it. And so you're actually becoming insulin resistant by having higher levels of visceral fat specifically. And at the same time, we'll talk why muscle is so important later in the process. But yeah, completely agree as far as fasting insulin being a huge piece to take a look at. Alongside, usually what's tested is fasting glucose, and that number is fine. It's not bad to get that number, but that's just telling a single snapshot in time of what your blood sugar is. It's not often enough to really get a clear idea of what's going on earlier, which is again that fasting insulin number trickling up and being a true indicator of insulin resistance in a lot of ways.
Yeah, and I mean, I like to think about it as from kind of it's like a drug addict analogy where basically, you need more and more of that drug, in this case being insulin, to accomplish the same hit or the same ability to kind of bring blood sugar into the cell. So, over the years, I think it's now as high as like 75 or 80% of people have some level of insulin resistance that's building, and they're even finding it now in like young kids, like, kids 7, 8, 9 years old, because of how, our diets as children have just, there's so many calories. And we'll talk about that here next in terms of just that calorie load that we're consuming on a regular basis really sets us up for insulin resistance, and that kind of overload of energy that just taxes the system and taxes the insulin to eventually not allow us to be able to keep up.
Yeah, I mean, you touched on it. It's again a combination of each of those things where you're bringing on so many calories that your body just only has so much they can get through. So it ends up kind of storing some of it away as fat, and some of that's going to end up being specifically that visceral fat that I was talking about. And then simultaneously, you're getting those high, blood sugar spikes and things, and higher, the higher blood sugar to go along with that. So it's kind of a double whammy there, where you're holding on to too much weight, and at the same time kind of seeing that blood sugar rise and rise and rise throughout the day, and then just desensitizing the system really to that insulin over time. So over the course of blood sugar spikes here or there, where you're overeating or whatever it is, enjoying yourself, like I don't think that's really causing much of an impact on your overall health. But yeah, when it's repeated over and over, especially in combination with that visceral fat, you just end up in a position where you lose that insulin sensitivity, and you start to deal with the effects of that insulin resistance, which I think is really where I want to transition to this next. Is why does this matter? Why should people be concerned if their fasting insulin's high? Like, how does that affect anything that goes on in their life, or specifically related to a lot of chronic diseases that are out there?
Yeah, I think bottom line is when you start to unpack the data and you look at chronic disease as a whole, almost all of it is driven by metabolic health or poor metabolic health in this case. So when you have increased body fat, low muscle mass, and spiking blood sugar, on a regular basis, day after day after day, you're really setting yourself up for increased inflammation. And over time, all of that chronic stress is generally going to lead us down a road that, all of a sudden we're diabetic, we've got heart attacks, we're on a whole bunch of medications, we're at increased risk of cancer. I mean, you could literally have a long list of all of the things that poor metabolic health and insulin resistance predispose us to, and how when we maintain proper insulin response, how those risks diminish, greatly, and put us in a position where, like, we go from potentially needing to be on 6, 8, 10, 12 medications to, we might not need any of these things. And you and I, we've seen this a number of times over the years, where it's like, you spend 3, 4, 5 months dialing things in, focusing on the blood sugar control with your meals, and building some muscle mass, and we'll kind of get into that a little bit more here in a second. But like all of a sudden you don't need to be on a blood pressure medication. You can get off of, your glucose levels are now back in a normal range. All of a sudden triglycerides, all these things start to improve. You can get off of cholesterol medication, and all of a sudden you go from being on 5 or 6 medications to potentially not being on any, because you literally just focused on your metabolic health and improving your insulin sensitivity. So yeah, I mean, I think like I guess I'd love to hear kind of your thoughts on, especially when we start talking about kind of the big ones, blood pressure, cholesterol, a lot of the heart medications for, risk of heart attacks and strokes and things like that. Kind of your 2 cents on why insulin sensitivity is such a big thing for people to focus on.
Yeah, I think sometimes you and I talk a lot about traditional healthcare and how there's a bit of a disconnect between, treating the root cause versus treating some of the symptoms. And you could argue that the actual diseases in some case of heart disease or call it diabetes, call it high blood pressure. If as far as those are quote unquote symptoms of the root cause, which is insulin resistance or that metabolic health side of the equation. So being able to, truly address that insulin, truly address, the visceral fat, truly address the metabolic health is, ultimately the cure, quote unquote, for what we're trying to do on the back end, which is again preventing heart disease, preventing diabetes, preventing, all of these chronic diseases that so many people end up getting in one capacity or another, or at least delaying them as long as possible. And with that, I think that if we can truly address the root cause, which again is that metabolic health side of the equation, you're going to see blood pressure come down. And we can spend a few minutes kind of unpacking blood pressure specifically and overall like how insulin impacts that. So for example, you hear a lot about salt, and I don't want to spend too much time on this, but you hear a lot about like salt causing high blood pressure, and there's certainly a bit of a correlation there, but arguably that's because of the insulin response. So what I mean by that is insulin naturally, if it's going up, it also draws in sodium in the kidneys, causes the kidneys to retain and hold on to more sodium. And then that sodium causes the kidneys to retain more water. So basically, as insulin's going up, so is that water retention in the process. And naturally, if you were to lower insulin levels, now your salt sensitivity isn't nearly as high. So a lot of things that we again blame on salt or blame high blood pressure on salt in this case, and then therefore blame that on or blame heart disease on salt, arguably again comes back to the idea of insulin resistance. And if you truly address that root cause, you're just in a way better position to prevent and reverse in many cases a lot of these issues, whether it's again blood pressure, diabetes, which is as insulin related as anything. It's truly the far end of the spectrum of insulin resistance. I would say, there's a spectrum to this. Mild insulin resistance is going to be more of like, yeah, the blood pressure's up a little bit, you're holding on to a few pounds. But then the far end of that insulin resistance spectrum is more of like advanced cardiac disease and diabetes, and ultimately why we see that be so negatively impactful and so highly correlated with heart disease is because diabetes is truly like the far end of insulin resistance, which is therefore placing you at the highest risk of basically every metabolic disease out there.
Yeah, and I mean, just to piggyback off of that for a second, like even you start looking at, things like cholesterol as well, is like if you're a diabetic, those cholesterol numbers are much more of a concern to you than if your blood sugar is stable throughout the day and you're in a really good position with that fasting insulin. So I think it allows us, when we can take control of our insulin sensitivity and keep our blood sugar stable throughout the day. Now we're in a position to be able to like really analyze these other biomarkers in a more effective way to actually assess our true risk, Whereas when we've got fires burning everywhere because we've got all this visceral fat and this inflammation and our insulin levels are out of control, we're just literally kind of at the mercy of the system at that point because we truly are, you know, at severe risk of having a major event on some level, whether that's a stroke, a heart attack, cancer. We kind of just have to like, look to the doctors, and we aren't going to really be able to advocate for what very well for ourselves because we're not really doing anything to support our bodies in a positive way. And so that's where the dependency side of the medications really creeps in, and where, yeah, you can see that cascade on the medication side happen very quickly where, you go from one medication to 10 and it doesn't take very long to get there because you're not taking care of yourself and you're not putting yourself in a good spot to be able to really take control. We use that term all the time of like, take control of your health. And I would argue, figuring out how to get your insulin sensitivity in a good place, and that's really again at the end of the day the first thing we need to do. So let's talk about that for a few minutes here of like, what does it look like practically? Like kind of those big take home points of how do we do this in an effective way to give ourselves the best chance to keep that blood sugar and those insulin levels stable. Let me ask you this. How much are you paying for health insurance every month? And how much of that is actually going towards keeping you healthy versus lining the insurance company's pockets while you pay high deductibles? That's why Brett and I switched to Crowd Health. It's not insurance. It's a community of healthy people who share each other's medical costs directly by cutting out the middlemen, bureaucracy, and the insane premiums that come with them. Between our two families, it's easily saving us over $2,000 a month. That's real money back in our pockets. And right now, if you use the link in the description, you'll pay only $44 a month for the first 3 months. That's $1,200 in extra savings just for getting started. If you're already taking your health seriously, why keep paying high premiums for others who aren't? The link is in the description. It's one of the easiest financial decisions you'll make.
Yeah, I think there's a few ways you could go with this. If I were to pick a couple, I mean, number one would be some level of like weight loss focus. I've touched on visceral fat enough, so I won't beat a dead horse there. But ultimately, if you're trying to improve your insulin levels, we have to be able to drop body weight. And like insulin resistance can show up for different people at different weights. Somebody could be call it 300 pounds and be in one spot. And someone could be, only 200 pounds and still have a similar level of insulin resistance. So there's certainly genetic components there. Even like ethnicities are going to show up a little bit differently. But at the end of the day, like improving your visceral fat, dropping your body fat is going to be, I would argue, one of the most important things that you could do, kind of no matter where on that spectrum that you fit, is if you can be leaner. And then the other side of that would be building muscle along the way. So dropping the visceral fat, but also building muscle in the process, because that muscle becomes a metabolic sink. And kind of explain, really what that means and how that works. But I would argue number two, then, if we're saying visceral fat's number one, number two would be the idea of depleting glycogen. And what I mean by that is you have glycogen is like a complex sugar stored in your muscles. So if you take glucose, put a few together, basically get a glycogen. And with that, you're able to kind of hold more of that within the muscle and within your liver. And that becomes your body's immediate energy source when, call it food runs dry, or you have some immediate exercise that you have to go and do. You want to have some stored energy available to you. So when we go ahead and we exercise, or we deplete that glycogen, so we do call it a lifting day, call it some harder biking, for example, something beyond like real easy that mostly you're using fat for. When you're doing a little bit harder exercise, you're burning off glycogen. And that matters because when you burn it off in the muscle, now that muscle becomes like an active sponge to try to pull some of that additional sugar out of the system or out of your bloodstream. And so you're soaking up any additional blood sugar that's coming on from your meals, for example. And now we're just keeping blood sugar way more stable in that regard. So it's kind of a hack to be able to, some people have kind of a sensitivity to carbs or like a fear of carbs. And I would argue that, there's a lot of value in being able to deplete that glycogen off, keep the muscles active, and just keeping your blood sugar significantly more stable and ultimately staying more insulin sensitive, because the amount of carbohydrates, for example, or just the amount of food intake that you're going to be able to have when you're active compared to inactive, and how your body's going to actually process and use that energy is going to look drastically different. So, yeah, kind of building the muscle, and then the more muscle you've built, you now basically have a larger sponge to continue to soak that up. So it's actually a snowball effect where once you get started on it, it actually becomes more and more of a net positive for you, because the muscle holds more glycogen, and the larger the muscle gets, it can continue to use more glycogen in the process. So kind of a long-winded answer of saying, like, yeah, exercise, obviously we know it's important, but that's kind of the breakdown on arguably the most important aspect of it, is kind of burning off that glycogen and what that does for our insulin sensitivity.
Yeah, and I'm glad you kind of went that direction too with the resistance training side of things, and why, I think both of us, we've done some endurance things. I obviously did a lot of endurance things. That was kind of the heart of what I did for a number of years. But now if somebody asks me, what's the highest ROI thing I can do for my body? Like, it's resistance training, for that very reason, is because, there's so many ex-athletes out there who they might be close to the same weight that they were before, high school, college. But I use the example of, like, oh, I was at my best at 200 pounds, and they still think like 20 years later, 200 pounds is kind of where they belong. But the reality is they've lost 10, 15, maybe even 20 pounds of muscle during the last couple of decades. And so now they're sitting at 200 pounds, but they just have 20 extra pounds of body fat and 20 less pounds of muscle than they used to. So, we see so many, kind of so much of that sort of, like, you hear like the skinny fat. And I think that is it does, you don't have to be 300 pounds to be, as you were saying earlier, like, to have insulin resistance. Like, there's the vast majority of the population is walking around with it right now because we don't have enough muscle on our frames. And so, yes, we want to be able to lose that body fat, but it gets a lot easier to be able to do that when you're also developing muscle at the same time, because you are going to be in a position to be able to eat foods like, I'd argue, like, you could eat something today with very, very little muscle mass and see a much bigger blood sugar spike than if you lifted weights for 3 months and then ate that same food. Because again, you've developed that sponge to be able to um, take that extra blood sugar up. And so that's where, like, yeah, when you start lifting weights, when you start dropping that body fat, going and having a piece of birthday cake at your kid's birthday party, or your mother-in-law makes a bunch of chocolate chip cookies, it's like you can enjoy those things, and it just doesn't matter that much if it's in moderation, because you've got that extra muscle mass to be able to support you. So you almost get this, like, advantage of being able to eat more of the things that you really like to do, assuming you're not going completely out of control with it. But, like, that whole 80-20 approach is so much easier when you're strong and when you're lifting weights consistently. Because again, if you're doing it right 80% of the time, those other 20%, in some ways, you could even argue your body's going to be able to use that extra energy and to build some additional muscle. But you just don't get that advantage when you're not lifting weights, and you're not depleting that glycogen regularly, to kind of put yourself in that position. So, yeah, and I guess the
Yeah.
only other thing I'd throw on. Go ahead, you got something to add?
Yeah, I was just going to say, I think that's arguably more important now than ever too, because we just live in a world where food is everywhere, and obviously a lot of people struggle with the idea that of how plentiful it is. So the concept that, like, hey, the more active I can be, and specifically on the building muscle side of things, that you can set yourself up to be able to, yeah, just have more margin. Again, I think that's just, like, never been more important, because, like, I think in general, like, the best approach to deal with a lot of that is to truly just, like, try to build try to build muscle in the process, because it just gives you that flexibility along the way. And yeah, at the end of the day, like, most people, if we went back 30, 40, 50 years, like, we're physically just going to end up weighing more these days than we used to, because we have more food around. So we might as well carry more muscle mass in the process, to kind of still end up in a very similar position from a health kind of on net health, if that makes sense. Because yeah, if you're gonna weigh 20, 30 pounds more than maybe what your ancestors did, you better be stronger than they were. And if you don't have, kind of a ratio of muscle mass to go along with that, like your net health is going to be poorer than theirs was. So yeah, that just came to mind, and echoing what you said, but kind of taking a different approach with it of like, uh, I think just embracing that makes a lot of sense. And obviously still being mindful around, the foods and things that we are putting in our body, but just recognizing like we don't live in the same environment. So we probably need to live a little bit differently than they did in decades past. And arguably, I'd say having additional muscle mass on your frame is a pretty um, simple approach to go about doing that.
Yeah, I mean the data is pretty staggering on that. You start looking at like average male, average female. I think it's yeah, right around 35, 40 pounds of additional weight that we carry now versus just like, 40 or 50 years ago. And yeah, it's clearly not an extra 30 or 40 pounds of muscle in most cases, but and I'm not advocating that like I really this is a little bit of a one of those things that it gets people a little bit fired up sometimes, but if you're not active, you know, we probably don't need to be walking around at 220 pounds. Like the average person probably should be sub 200 pounds unless you have truly built a good bit of muscle. And that's kind of a hard pill to swallow for most, but it's you start looking at it big picture of like how much muscle do I actually have here, and it doesn't matter what you had 20 years ago, but like what do you have today? Like what does your environment set you up for? And if you've got it's kind of one of the advantages too. Like if you are carrying some extra mass right now, your body actually has that extra energy where even if you're in a calorie deficit, you to try to lose some of that weight, if you're stimulating the muscle, you actually should be able to build more muscle quicker than somebody who's not carrying quite as much weight. So, kind of use that to your advantage, and I really think that that can even be a starting point for most people when it comes to activity. And that was kind of my, you know, kind of from an activity side of things when it comes to blood sugar control and insulin sensitivity. It's like, yeah, let's lift weights so we can take advantage of this, and then piggyback that with walking. And it's like we don't need to be killing ourselves on a treadmill 3 4 times a week to see results here. In fact, that's probably actually going to make you more hungry if you're struggling with insulin sensitivity, is because you're gonna deplete that end that, it's gonna deplete all that glycogen, and you're gonna end up in a pretty extreme deficit, and then you're gonna wanna, kinda undo that very quickly with the fork. That's why I really like the idea of using the resistance training and walking to be able to kinda have the best opportunity to do this in a sustainable way. And just to kinda talk specifically about walking, it's very, very low stress on the body. Again, we're as humans, we're almost designed to walk indefinitely. Obviously we got to sleep and we've got to eat and things like that, but like it's not hard for our bodies to do. We're just designed to be able to do it, pretty much all day if we needed to. And so when we're doing it, we're able to kind of tap into that stored fat and keep our blood sugar quite stable. So, even being able to like eat a meal and go take a walk versus eat a meal and then sit and watch Netflix, you can see like a 40% difference in your overall blood sugar spike just with a 10 or 15-minute walk after a meal. So, and that's just kind of one example, but in general, just the more that we can be walking and moving at that lower intensity, it just really, really helps us to be able to keep blood sugar stable, to recover, and just set ourselves up for success when it comes to just overall metabolic health.
Yeah, I think that's kind of the best third point that I'd be able to come up with, as far as key things to be focusing on. And shed some excess body fat, build some muscle, deplete that glycogen, and then just getting the activity up with regards to, call it walking as a baseline kind of low intensity activity that most people can find a way to at least get in some capacity. So, yeah, I love it around meals. I think that's underrated, being able to get out there after dinner, for example. And, we've talked in the past about maybe getting the family out on a walk as well. So something simple like that to add into your routine where it's like, maybe I'm going to spend, 20 minutes getting out there after dinner and kind of seeing how that affects things. And just, again, kind of just adds energy, allows your body to kind of get through that meal and digest it a little bit easier, and all the net positives that come with that. So yeah, I'm a huge fan of that. From just a little bit more of like a practical step, is like something we can try to implement in our own lives, is like, hey, after dinner, I'm just getting out for a walk as kind of a basic first approach to this. And then obviously more of the structured strength training and things like that with regular exercise routine. And then kind of a full on approach to the body fat loss, which is, it's going to be mostly nutrition. Realistically, I'd say 80-20 as far as that goes, 80% nutrition related. But yeah, just being able to make tangible steps in your nutrition, which obviously we've talked about in the past, and we'll continue to discuss further the idea of nutrition in future podcasts. But yeah, can't can't overemphasize the idea of how important nutrition is if your goals are weight loss related, and not trying to outwork a bad diet in the process.
Yeah, I think that's all well said. I think, insulin resistance is just one of those topics where we could spend 3 hours unpacking, and maybe at some point we will. But I really think that this hopefully gave listeners a really nice overview of some starting points, a better understanding of it. It's one of those things that, to be honest, I would encourage everyone to be able to kind of have this conversation with their doctor. One of my rules, this is a little bit off topic, but like if I can't have a conversation about insulin resistance with my doctor, or they don't understand it at all, then I'm probably going to go find another one. So I don't want to put anybody in a bad spot or an uncomfortable spot, but it's foundational to health. So we need to understand it, and put ourselves in a position where, yeah, if 80% of the population is insulin resistant, let's reject the average. Let's set ourselves up for success, so that we can take care of our metabolic health, and in doing so, really set ourselves and our families up long term for health and longevity. So appreciate you guys listening again. This is the Rejecting Average podcast, and we'll see you next week. You guys know we're big on keeping things simple. Whole foods first, always. But when it comes to hitting your protein targets on a busy day, sometimes you need a little help. That's where Legion comes in. Grass-fed whey protein that my kids think tastes like dessert. And I know exactly what's in it because they third-party test all of their products for things like heavy metals. For busy families looking for convenient ways to hit their nutrition goals, it's a great tool to have in your back pocket. Use code B2B for a discount, or the link in the description, and you'll receive cash back on all future purchases.